Hello everyone, today we will study the etiology of the periodontal disease. So let's begin. The periodontitis is a multifactorial disease in which microorganisms and the microbial products in the dental plaque are the main etiological factors. The other factors are the host factors and the environmental factors. So let's talk about the agent factors. It consists of dental plaque. Dental plaque is defined as the structure, resilient, yellow-grayish substance that adheres tenaciously to the intraoral hard surfaces, including the removable and the fixed restorations. The dental plaque can be classified as the supragingival plaque, which is found at or coronal to the gingival margin, the subgingival plaque found apical to the gingival margin. How is this formation? The formation of the plaque by three phases. The formation of the pellicle, the initial adhesion and attachment of the bacteria, colonization and plaque maturation. Plaque biofilm. A plaque biofilm is a well-organized cooperating community of microorganisms. They are composed of microcolonies of the bacterial cell non-randomly distributed in a matrix. Then we have the calculus. The dental calculus is a hard deposit that forms by the mineralization of the dental plaque and is usually covered by a layer of the unmineralized plaque. Calculus can be classified as supragingival calculus and subgingival calculus. The supragingival calculus is located coronal to the gingival margin. It is white or whitish yellow in color and has a hard clay-like consistency which can be easily detached from the tooth. Whereas subgingival calculus is dark brown or greenish black in color and is hard and dense, which is firmly attached to the tooth surface. Now the next factor, that was the agent. The next factor is the host factor in the periodontal disease. There are age, gender, socioeconomic status, diet and nutrition, anatomy, habits. Similarly, the local factors. Age. The prevalence of the periodontal disease has been found to be increased with the age. This is because the cumulative progression of the lesions over the time and not because of the increased susceptibility in the older individuals. Gender. The male have a higher prevalence and severity of the periodontal disease than the females. However, the current knowledge of the pathogenesis of the periodontal disease indicates no inherent difference between the man and the woman in susceptibility of periodontitis. Socioeconomic status. The periodontal disease has been related to the lower socioeconomic status. That is because the lower socioeconomic status results in the poor diet, poor oral hygiene, and a general lack of the dental awareness. They cannot afford the high cost of the dental services, and even the simple oral hygiene measure involving the toothpaste and the toothbrushes. Next is diet and nutrition. The sticky food, like the chocolates, candies, bread, jam, butter, peanut butter, chocolates, soft breads might aggravate an already existing periodontal problem. Studies have shown that higher prevalence and the severity of the periodontal disease in the area where the protein, calorie malnutrition and vitamin A deficiency are common. Anatomy. Next is the anatomy. It also depends upon the correct form and the position of the teeth in the dental arc. Tooth. Regarding the tooth, the poor cusp anatomy, uneven marginal ridges, lack of the contact between the teeth and crowding can cause food impaction, accumulation, and underlying gingival tissue to become irritated and inflamed, result in the periodontal disease. Soft tissue. The proximity of the frenum to the marginal gingiva interferes with the proper use of the toothbrush in the area. The incompletely erupted third molars partially covers the gingival flaps are often site for the pericoronal infections. Next is habits like the unilateral mastication, abnormal habits like biting, a pencil, finger, nail, toothpick, etc., opening of the bobby pins, lip biting, cheek biting, occupational habits like thread biting, holding the nails between the teeth. The habits cause the traumatic injury to the periodontium. Now, local irritants. There are mechanical irritants The faulty tooth brushing can cause the abrasion or the recession of the gingival tissue, and similarly, faulty dentistry such as the overhanging margins of any restorations, faulty orthodontic treatment due to for example, too rapid tooth movement, too vigorous pressure, not allowing the sufficient resting time between the application of the pressure. Chemical irritants. Alcohol, tobacco directly lowers the tissue resistance and increases the gingival susceptibility to the gingivitis and the periodontal diseases. The cigarette smoking is a major modifiable risk factor for the chronic periodontitis. Anatomic irritants. Because of the obstruction in the nasal passage, habit malocclusion, systemic disturbances, and the psychosomatic factors. Some patients breathe through the mouth. The dehydration of the mucous membrane of the mouth leads to the lower tissue resistance. The tissue enlarges and becomes fibrotic, resulting in the gingival enlargement and inflammation. Systemic factors. Many systemic factors and disorders have implicated as a risk factor in the periodontal diseases. Example: anemia, puberty, pregnancy, gingivitis, diabetes mellitus, leukemia, hyperparathyroidism, HIV/AIDS, radiation, drugs such as the dilantin sodium. The next factor is environmental factor. Here, the geographical variation and the degree of the urbanization. Geographical variation. Earlier studies shows that the considerable difference in susceptibility of the periodontal disease between the nations. Degree of urbanization. The people living in the rural areas have significantly higher prevalence of the periodontal disease than in the urban people. Psychological and cultural factors. The anxiety, fear of the dentist, lack of the knowledge about the diseases and the treatment are some of the relevant psychological factors. So this is all about the etiological factors, which consist agent, host, and the environment.